Welcome, my brilliant providers. I'm Marinda Nelson. I help you make your dream practice inevitable. Who am I? Why do I give a shit? Why does your practice have anything to do with me? And how do I do it? Nice, but you're just so burnt out, you can't even think about it, right? I hear this time after time as I'm communicating with providers. I'm just so burnt out that I can't even think about my dream practice. I don't even know what I want. I just want to not feel so burnt out anymore. And they tell you to not accept an extra shift, or they tell you to thin out your schedules, or they tell you to just take a nap, get some good rest, have a spa day, take some vitamins. And then there's surface superficial top 10 tricks list everywhere. Here's the thing. As a youngster, I was a sick kid in rural Wisconsin. And every 2 or 3 weeks, we would go to the cities to a new specialist to try to help me feel better. And every 2 or 3 weeks, I would feel dismissed. It would be completely unproductive. We would be so frustrated that nothing was helping. It didn't seem like anybody was listening to us. They kept trying the same things over and over and over. There just seemed to be no progress. It wasn't until I was 15 that we finally saw a provider that listened, that actually read the chart, that sat down and had a conversation with my mom was always the one that came with me, that actually did something, that actually made the changes that helped and that worked. Then I had a resurgence of some things that manifested in different ways in my early 30s that again, I was frustrated and feeling dismissed and had terrible experiences in healthcare. Well, this is just the diagnosis you have. This is just the way that it's going to be. Good luck. To the point where I thought, if this is as good as it gets, I'm not living like this. I'm not living like this. And I started thinking about ending it, about ending life for me. And I don't want anybody else to deal with that. Also, along that, because I had had those experiences and I didn't want those experiences for anybody else, I got really great at healthcare in all of the multitudes of roles that I had along over the years. Everything from front desk to clinical research to technician to department managers and training and hosting, sitting on panels and doing workshops and all these things. I realized though that helping one provider improve their practice or do what they wanted to do or do it how they wanted to do it at a time was too slow. I wanted to help more people faster because what I realized that is that while I had had so many terrible healthcare experiences, doctors themselves are incredible, brilliant, generous, wonderful people that truly just want to help, that have worked and trained and school and studying and so much because they want to help people. What I learned and what has now been studied and researched at Harvard is that a happy provider is a better provider. If you are in a good place mentally, if you are in a good place physically, but we see so many providers also frustrated and either feeling defiant in their frustration, rebellious, ready just to lock heads with anybody that they run into. I'll show them this can be so much better. It doesn't have to be this way. Why don't they get it? Why won't they just listen to me? Right? Or defeated, nauseous on the way to work for your next shift, trying to either psych yourself up or settle yourself down, trying not to turn the car around and actually go to work. How many of you have done that? Or completely just disassociated. You are going through the motions. You're showing up. You're doing what you got to do. You're looking at the numbers, kind of looking at the charts. Yep, there's this diagnosis. We do this, this, this. This is policy. This is standard of care. This is just what we do. Here you go. Bye. And then I talk to providers now and I say, hey, what would you love? If you could have the practice of your dreams, what would that be? And so many tell me, I'm so burnt out right now. I just need to get through this. I can't even think about it. And here's the thing. That's what the establishment wants. That's what they need, is to keep you so burnt out that you don't think about how else it could be, that you don't think about what your dreams are, that you don't think about the incredible provider that you want to be. So I help you break the burnout cycle and think about your dream and bring it into being. Because while, yes, this system is screwed up, and while, yes, none of us are loving what's happening in healthcare in the US right now, we are the system. And as providers, it starts with you. You are the center of the system. And so, as providers sticking together and bringing your dreams into being, you are the ones that will transform the system into what we want it to be. Now, here's the thing. It doesn't need to be more work. When you practice the way you want to practice, it's actually less work. It's not some arbitrary to-do list because you have to. It's you doing what you love to do. I deeply believe that all change starts within. It starts within you. And then it grows and it expands to all of those around us. And it grows and it grows and it grows. And by the time that we get to this point, that we will transform the healthcare system, that we're going to do it one provider at a time. You are an individual human with individual dreams and desires and goals. That's this next era in healthcare. While the technological advances of the last number of many years have been absolutely amazing, this next era is about the human. And it starts with you. Embracing all of who you are, even the parts you're not supposed to be. That's probably your specialty. That's a strength that's there to support you, not something to be shoved down and suppressed. I believe that fear has no place in medicine. Fear has no place in healthcare. It does not need to be there. That healthcare and that medicine is a place of hope, options, and opportunity. I believe this deep in my gut, in my soul. This is one of my core beliefs. Imposter syndrome, compassion fatigue, and burnout can absolutely be eliminated. They don't need to be treated. They don't need a nice pearly little coating put over them. They don't need to be just as symptoms on the superficial level, that they can be eliminated, gone. I believe there is no reason for Western spiritual and traditional medicine to be separated. This is seeing the whole human that's in front of us, listening to their beliefs, their dreams, their desires, their expression, and then pairing them with the resources that we have available. That is our role as a provider. And these are all resources that are available. Your upgrade will not require more stress, more work, or more time. It will not. I've proven it over and over and over and over and over and over and over. We can double your department revenue and not have it be more work. We can increase your surgery schedule by 30% and have it be less work for you. I've done this over and over and over. This is 100% possible. It absolutely gets to be fun and fulfilling. You get to be your authentic self. You get to practice the way that you want to practice. And it gets to be prosperous and profitable. You get to have a successful practice. Your transformation into this will be profound. It will be profound. There is a process, but it is personal. It's yours. It will be profound, but it does not need to be difficult or hard. You're willing to do the hard. You're willing to put in the work. You're willing to do what you need to do. But no longer do I value struggle, overcoming. It's not necessary. As providers, we are fortunate to be valuable resources for our patients on their healthcare journey. We get to do what we love, and they get the assistance they're looking for. It is not a top-down dynamic. It is a working together to help them achieve their goals dynamic. At the core, my why statement, why I get up every morning, why I've been putting these videos out for years, why I send so many of you notes with information about who I am. My note says, how can I help? How can I help? How can I help? I write this over and over and over and send these little notes out. Is that I know when you are the provider that you want to be, that these dismissive and frustrating and lacking progress experiences that so many of us have had in healthcare, that they go away. I know that when you're the provider that you want to be, that when we open you up for that, when we help you see that you're amazing, when I help you get clear on what it is that you want and know that you can do it, when I help you trust you, that the experiences that my friends and my family have in healthcare, that our communities have in healthcare are improved. I don't want them to have the experiences that I had. I want no one to have the experiences that I have had in healthcare. And I know that by me helping you be the provider that you want to be, that together we can help the patient have the experiences that they want to have. And those patients are our families, our friends, our communities, that together we can help healthcare be what we want it to be. This week, I will be talking about the different programs that are available. I will be talking about the different ways that I help, but it is available on my website, leadersin.healthcare. That's the website, or spiralcoachingandconsulting.com. They'll both take you to the same place. The page, the spiral, has all this information on it. Also, when you go to the home page, there's a button, and it's time to talk. It's time to talk. Push that button, schedule an appointment with me. Let's talk. Send me an email. I want to work with you. I want to hear from you. I'm here to help you. People are looking for you. People want the provider that you want to be. If you are looking for this information, I do workshops. I come in to associations. I come into schools and talk about eliminating burnout. I talk about developing, leading, and expanding the fun and fulfilling, authentic, and prosperous and profitable practice of your dreams. Follow along on both my personal as well as my professional platforms. DM me, message me, be in touch with me. I'm available to you. Share this information out. Share this page out. Let's eliminate the burnout that they need you to have to control you so that you can be the provider that you want to be. Let's get you thinking about those dreams again. Let's get you loving what you do again. So talk to me, push that button, time to talk, DM me, send me an email. You guys, we got this. We got this. There's so much that you can do. There's so much that you've done. There's so much that you've already accomplished that you just don't realize applies to what you're doing and to what you want to do. You got this. Your dream practice is inevitable.